We'll now move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is to the Premier. Yesterday in this House, the Minister of Internal Services said, and I quote, that the government has procurement processes that are very in-depth, that they follow the procurement law to the letter, and I'll table that quote from Hansard, Mr. Speaker. It seems very odd, since a Freedom of Information request confirms that the government has gone around its own procurement laws over 9,000 times since it took office in 2013, and I will table the list of exemptions the government has provided to itself from its own procurement laws. So I'd like to ask the Premier, why does this government claim to be following the letter of the procurement law when they exempted themselves from that very law over 9,000 times?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. As the Minister would have said yesterday, we would follow all of the protocols and procedures required when it comes to making sure that we get the best value for dollar, and I think that demonstrates, Mr. Speaker, what a very active government we've been.
The Honourable Leader of the Official Opposition.
Yes, indeed, they are very active, Mr. Speaker. The Minister of Internal Services also went on to say our procurement processes have a strict policy of being open and transparent, and all of the RFPs and rewards are posted. So let's just see how active the government has been in its purchasing. Among those 9,000 items, Mr. Speaker, are $5,400 so that the Department of Communities, Culture and Heritage could buy 3 paintings, $8,389 to the Liquor Control Board of Ontario for, and I quote, food and drink, and $135,000 to consultants in Ontario and BC so that the Premier could design his Made in Nova Scotia carbon pricing law, Mr. Speaker. So I'd like to ask the Premier, in light of these revelations, will he concede that his strict policy on procurement is in fact not very strict at all?
The Honourable Premier.
Speaker, I want to thank the Honourable Member for the question. I'm assuming by the beginning of it he doesn't believe government should buy any art from Nova Scotians. I'm assuming that's what his assertion is at the first example, Mr. Speaker. But I want to tell the Honourable Member, which I said from the very beginning, I make no apologies for this, Mr. Speaker. I've gone out to hire the best help that I can get, Mr. Speaker, and if I need to hire that outside of this province to ensure that when our government goes up, to, whether it's in negotiations, whether ensuring that we do deliver good public policy, we're going to do that, Mr. Speaker. And the fact of the matter is, in 4 short years, we took a $500 million deficit, provided 2 consecutive balanced budgets, introduced pre-primary programs, makes the most vulnerable citizens of our province were treated properly, Mr. Speaker, and we're going to continue to go looking for the proper help, Mr. Speaker, so that Nova Scotians finally get the government they deserve.
The Honourable Leader of the Official Opposition on his final supplementary.
Well, Mr. Speaker, let's just examine further whether this government makes good use of taxpayers' money when they exempt themselves from their own purchasing laws or not, because additional purchases made by sole source outside of the public tendering process, Mr. Speaker, are $8,500 so that the Department of Natural Resources could sole source a pregnant reindeer. I don't know what the market price for a pregnant reindeer is, Mr. Speaker, but seems like a lot to me. And $50,000 to a company called Laughter Size Seminars, which offers, and I quote directly, a unique combination of music, humor, and audience participation to their clients, which apparently include the Government of Nova Scotia. Now, we could all use their services right now, Mr. Speaker, as we see the use of taxpayers' money, but I would like to ask the Premier, will he commit to a public review of his government's purchasing policy when they exempt themselves from their own laws and make that report public?
The Honourable Premier.
Thank you, Mr. Speaker. Again, I want to thank all of my colleagues for their hard work they're doing on behalf of all Nova Scotians. Continue to deliver them government, Mr. Speaker. Mr. Speaker, to respond to the first example you had around the reindeer, Mr. Speaker, it's a great example of getting 2 for 1.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. I'd like to direct my question to the Premier. It's about the minimum wage. Yesterday, the Minister of Labour and Advanced Education publicly characterized people making less than $15 an hour as teenagers and young adults just starting out, as only temporarily in a low-wage position. But we know that 70% of minimum wage workers are not people who live with their parents. And all of us know people like Simone Maillet, who has worked at the cafeteria at Université Sainte-Anne for 41 years and makes $14.32 an hour. Do people like Simone Maillet fit into the Premier's picture of low-wage workers in this province, or does he agree with his minister that it's all okay because they're mostly just kids?
The Honourable Premier.
Speaker, again, I want to thank the honourable member for the question. As he knows, we've had this discussion, I think, every question period since this session started. I'm looking forward to continue it. I want to remind him he voted against a budget that took 60,000 Nova Scotians off the tax roll. Mr. Speaker, those are low-income Nova Scotians, middle-income Nova Scotians. He voted against the budget that would have given a $3,000 increase to the basic personal exemption, Mr. Speaker, for low-income Nova Scotians. Mr. Speaker, he's voting against pre-primary, which would allow the 75% of children of 4 years old, some of whom come from low-income families, access to a play-based, evidence-based program that would give them a better look for their future, Mr. Speaker. He's voted against every rent supplement that we've had in this province for low-income Nova Scotians as we reduced, Mr. Speaker, the wait list for affordable housing by 20%. Mr. Speaker, we're going to continue to work with Nova Scotians, Mr. Speaker, in every category to ensure that this government continues to provide public policy that reflects their concerns, Mr. Speaker.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. Tax reform and educational policy and social housing policy, these are all questions for the debates of another day. Today, I'm asking the Premier about a $15 minimum wage. Now, just recently, 40 leading Canadian economists joined together to write an open letter explaining that a $15 minimum wage does not impede job growth because it increases the customer base for the things that businesses have to sell. Mr. Speaker, how does the Premier think our economy in Nova Scotia can prosper when 130,000 people, that's just short of a third of our province's whole workforce, are making under $15 an hour?
The Honourable Premier.
Mr. Speaker, again, I want to thank the honourable member for the question. Again, I want to tell him this is a philosophical difference, Mr. Speaker, between the honourable member and myself. Fact of the matter is, Mr. Speaker, we believe there's a better way to leave more pockets in the hands of low-income Nova Scotians. We've increased the basic personal exemption. That means, Mr. Speaker, those making the least amount of money in this province are getting the largest benefit from that. If you look at the investments we've continued to make, we increased the HARP program, so 5,000 more Nova Scotians will have access to support when it comes to heating their homes, Mr. Speaker. The list can continue to go on. I want to tell you, Mr. Speaker, the fact of the matter is, Mr. Speaker, when that government had an opportunity to be in power to move this province forward, they ignored the challenges being faced by low-income Nova Scotians, Mr. Speaker. The economy suffered under it. They get more corporate welfare, I believe, than any government in the history of this province, Mr. Speaker. Where were their social values when they had an opportunity to actually do something for Nova Scotia?
The Honourable Leader of the New Democratic Party.
Mr. Speaker, we are not interested in a demonstration of the Premier's abilities as an historian. We are interested in the question of $15 an hour as a minimum wage. Now, this government, in 4 years, has increased the minimum wage by a grand total of 55 cents an hour. That works out to around 14 cents a year. At this rate, it'll take 30 whole years for Nova Scotia to reach a $15 minimum wage. Mr. Speaker, does our Premier really think it's acceptable to tell the people of the province that they should wait until 2047 to have a $15 minimum wage?
The Honourable Premier.
Thank you, Mr. Speaker. What I think is important, Mr. Speaker, the fact that we had an opportunity, Mr. Speaker, to ensure that the most vulnerable in our province were treated properly, Mr. Speaker. Every piece of public policy reflects that. I want to remind the honourable member again, we 5,000, Mr. Speaker, Nova Scotians now have access to HARP, Mr. Speaker. Mr. Speaker, I want to remind the honourable member, Mr. Speaker, that when we rent subs, affordable housing for low-income Nova Scotians, Mr. Speaker, I want to remind him again, Mr. Speaker, 60,000 more Nova Scotians do not pay tax, Mr. Speaker. When you had an opportunity, let me be very clear about this, Mr. Speaker. When that party had an opportunity to improve the lives of Nova Scotians, what did they do? They became paralyzed by the opportunity, and they handed corporate welfare out, Mr. Speaker, in this province like it was candy, and they forgot about those people who require the support of government, Mr. Speaker. They talked about it time and time again, Mr. Speaker. The fact of the matter is they were paralyzed. We've acted.
The Honourable Leader of the Official Opposition.
Can we get back to the pregnant reindeer, Mr. Speaker? It was much more fun. Mr. Speaker, when the Minister of Internal Services claimed that the government had a strict procurement policy, one can only wonder if she was also counting the Nova Scotia Health Authority. Last week, I asked the Premier if he could name the external agency that the Health Authority has engaged to recruit doctors. I asked him that because the Health Authority refuses to tell the public who it is. I will say, Mr. Speaker, we now know that it was National Public Relations. They may be a great PR firm, Mr. Speaker, but they are not a specialist in doctor recruitment. Perhaps that's why the Health Authority didn't want to tell us. So I'd like to ask the Premier, since he agreed he would check into this, if he can explain to this House why the Nova Scotia Health Authority refused to tell Nova Scotians who they had engaged to recruit doctors. Was it because it's a public relations firm and not a doctor recruitment firm at all?
The Honourable Premier.
Again, I want to thank the Honourable for the question. I want to continue, Mr. Speaker, to remind him of this very important issue. The current budget that he voted against, Mr. Speaker, provides funding to provide 70 collaborative care centres across the province that allow us to have access, Mr. Speaker, to primary health care teams in communities that require them. You would also know there are 10 additional residence seats on top of the 35 that are currently at Dow, Mr. Speaker. On top of that, there will be 10 resident seats that will allow, in terms of allowing foreign-trained doctors to get Canadian credentials, Mr. Speaker, to be able to operate in this province. Yesterday, I was very proud of the Department of Immigration has worked with the Health Authority to go to the UK to continue to attract and retain more physicians, Mr. Speaker. We know there's more work to do and we'll continue to do so.
The Honourable Leader of the Official Opposition.
Well, Mr. Speaker, the Nova Scotia Health Authority claims to have complied with the government's purchasing rules, the rules that the Minister of Internal Services says are so strict. But that's odd, since there is no record of a publicly posted competition for the important work of hiring an agency to recruit doctors. And now we know why, because it's not a doctor recruitment firm at all. It is a public relations agency. Now, what could be more symbolic of the way that the health system is being run than that they hire PR people when we need more doctors, Mr. Speaker? So I'd like to ask the Premier if he will commit, if he won't commit his own government to a review of their purchasing, will he commit to a public review of the purchasing policies of the Nova Scotia Health Authority and tell Nova Scotians what's really going on over there?
The Honourable Premier.
Speaker, again, I want to thank the Honourable Member for the question. Mr. Speaker, again, I want to thank all those hardworking public servants who are working with our government to continue to ensure we provide those services to Nova Scotians. Mr. Speaker, when we put an RFP out looking for bids from people across the province, we want to thank all those across the country and all those who continue to apply for those bids. Mr. Speaker, we're going to continue to make sure that we provide the most cost-effective way of delivering services and goods to Nova Scotians, and I'm very proud of the work that our government has been doing, Mr. Speaker, and I'm really grateful to be given the privilege to continue to do it.
The Honourable Leader of the New Democratic Party.
Thank you. My question on the subject of rent control is for the Premier. Rents have gone up 10% in Halifax this year, and the city is now on the list of the top 10 most expensive rental markets in the country. Average rent for a two-bedroom apartment now across the whole province has gone over $1,000. Mr. Speaker, the Premier has dismissed our party's rent control proposal, but how does he think our economy can prosper and function when here in the HRM alone there are 42,000 households paying more than 30% of their income out in rent?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. It's unfortunate he didn't realize this was a problem when he was in government. He was sitting on the $40 million that the federal government had transferred to this province for housing, Mr. Speaker. So while they were paralyzed, Mr. Speaker, in 2013, we started to use rent supplements that provide low-income, medium-income families, Mr. Speaker, access to affordable housing. We know there are across the province, and some of our constituencies are not served by this area. There's challenges around affordable housing as well. We know there's required an investment in the housing stock that we own as a province, that the public of Nova Scotia own. We're going to make that investment. The budget he voted against, Mr. Speaker, had money in to continue to make those investments. Well, again, I want to remind the Honourable Member, while he was paralyzed, we're acting on behalf of Nova Scotians.
The Honourable Leader of the New Democratic Party.
Once again, Mr. Speaker, the Premier's dubious skills as an historian are not being upgraded during question period. I want to return to this subject. In dismissing our rent control proposal, the Premier 2 days ago said publicly that the thing that should set the price for rent is the market, and that we need to make sure property investors are making money. Mr. Speaker, Quebec doesn't think this. That's why they've brought in rent control. And Ontario doesn't think this either. That's why rent control is being implemented there. Can the Premier offer any evidence from anywhere for his view that a hands-off approach by government can solve the problem that we've got 42,000 households in the HRM paying out more than 30% of what's coming in just for their rent?
The Honourable Premier.
Mr. Speaker, again, I want to thank the honourable member for his question, Mr. Speaker. We're going to continue to make sure that those vulnerable families, those Nova Scotians that require affordable housing, Mr. Speaker, are going to have a myriad of options, Mr. Speaker, to access housing, whether it is with subsidy to a rent, Mr. Speaker, whether it's the fact that we're working with the private sector to build affordable housing in communities across this province, Mr. Speaker, or whether or not we continue to invest in our own housing stock to ensure that we have many options in many of our communities across this province. The fact of the matter is, this is a philosophical difference between the honourable member and myself. The fact of the matter is, his bill that he's referring to has not made a lick of difference for any Canadian, Mr. Speaker. But I want to remind the honourable member, this is the fact. We are helping Nova Scotians now find themselves into affordable housing. I want to remind the honourable member, we've reduced the wait list by 20%. That was under their government, and we're going to continue to reduce as we go forward.
The honourable member for Pictou East.
Thank you, Mr. Speaker. My question is for the Minister of Internal Services. Yesterday, I mentioned that Sierra Systems was awarded a tender for $3.8 million, a tender that we've now come to learn we've paid $7.3 million for, and that number will continue to climb. We also learned that for the same project, Sierra Systems also received $1.7 million in contracts awarded through alternate procurement practices. Now, a FOIPOP request reveals that Sierra Systems received an additional $43,000 for that same project, $43,000 that we didn't initially know about because it was wrapped up in payments made to FlexTrack. If the department already had multiple agreements with Sierra Systems, including a seemingly wide-open tender, why did the department need to use the cover of FlexTrack to pay more money to Sierra Systems?
The Honourable Minister of Internal Services.
I'd like to thank the member for the question, and I'd like to reiterate my statements from yesterday in that our government is dedicated to being open and transparent, and we use our procurement processes in all of their entirety, including alternate procurement process following that law, the laws that it falls under. In terms of alternate procurement, there's many reasons why. Our emergent situations, specific situations, and I will table for the member the use of our procurement protocols, which detail why these would be the case.
The honourable member for Pictou East.
The same IT help desk application involved another tender awarded to Livis Consulting. That tender was awarded for $300,000, but Livis Consulting ultimately received $535,000 for that tender. Again, almost double. I feel like I'm repeating myself, Mr. Speaker, but a FOIPOP reveals that Livis Consulting received an additional $32,000 that we also didn't know about initially because it was also wrapped up in FlexTrack. So if we're really interested in openness and transparency, my question for the minister is, will the minister promise to table in this House a full listing of all contracts that her department has awarded through FlexTrack?
The Honourable Minister of Internal Services.
I'd like to thank the member for the question. FlexTrack replaces many of our traditional government procurement standing offers, and I'd be happy to table the most recent report that we've had for his.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. While we're on the alternate procurement run, my question through you is to the Minister of Health. FOIPOP revealed that on March 27, 2015, the Department of Health and Wellness applied to the Government Department of Justice for permission to retain private legal counsel. The Department of Health and Wellness needed a lead negotiator for physician compensation negotiations with Doctors Nova Scotia and cited that the expertise was not available within the Legal Services Division for this purpose. The application was signed by the Deputy Minister of Justice, approving $150,000 for Jack Graham to act as lead negotiator. With all the labour negotiations that his government has engaged in, I'm surprised that the expertise could not be found within the public service. Could the Minister of Health tell the House what expertise did Jack Graham provide that the government did not already possess?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. As the member would know, Mr. Speaker, as you would know, and others in the Legislature, if they look back at the negotiating process with Doctors Nova Scotia, the bargaining agent on behalf of physicians throughout the province, Mr. Speaker, the member would realize that that was an agreement that was ratified in 2016, Mr. Speaker. We know that we have a number of other collective agreements that are outstanding. The work is continuing internally, Mr. Speaker. So again, I think the work that was done by Mr. Graham and the negotiating team and the sports, it certainly helped us achieve our outcome, which was to get an agreement with Doctors Nova Scotia that had about an 86% vote in favour by physicians, Mr. Speaker. I think that's a job well done.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. You know, a second FOI revealed that on March 27, 2015, the Department of Health and Wellness applied to the Department of Justice for permission to retain private counsel once again. The Department of Health and Wellness needed a lead negotiator in physician compensation negotiations with Doctors Nova Scotia and cited that legal service lawyers were not immediately available to do the urgent work. The application was signed by the Deputy Minister of Justice, approving another $440,000 for Jack Graham to act as lead negotiator. To recap, we have two applications for two different amounts for two different reasons, but the applications were on the same day for the same person to do the same job. Did the Minister of Health need private counsel because of the lack of expertise, as the first application stated, or was it an urgent need, as the second application stated, or did the government decide that it was just going to give Jack Graham $440,000 and figure it out when they could sit down and talk about it?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. As I stated, Mr. Speaker, as you and the members of the Legislature would know, Mr. Speaker, the negotiations within the healthcare system are complex. That's a process that was ongoing. Of course, the importance of primary care providers, including physicians, Mr. Speaker, is paramount importance to ensure that our healthcare system continues to operate through the negotiation process, Mr. Speaker, and part of that team that was negotiating on behalf of the province of Nova Scotia. Indeed, Mr. Speaker, that's on behalf of the people of Nova Scotia, the taxpayers of Nova Scotia, Mr. Speaker, and they achieved, Mr. Speaker, an agreement that received over about 86% support by the physicians of the province of Nova Scotia.
Order, please. The Honourable Minister of Health has the floor.
As I said, Mr. Speaker, that resulted in an agreement between the province of Nova Scotia and Doctors Nova Scotia, which resulted in ratification of about 86% of the physicians of the province of Nova Scotia, Mr. Speaker. That is a job well done. Thank you very much.
The Honourable Member for Dartmouth East.
Thank you, Mr. Speaker. My question is for the Minister of Education. This week, we learned that the replacement for the Le Marchant St. Thomas Elementary School in Halifax has been delayed to 2019. The department concluded that enrollment would be higher than expected because of local demand for the French immersion program. However, the Secretary of the School Advisory Council said that demand was clear and that the department's small enrollment numbers never made sense. And I'll table that, Mr. Speaker. My question is this: why was the department unable to accurately project enrollment before promising families a new school? Thank you, Mr. Speaker.
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. In fact, enrollment numbers are projected by the boards, and it was the board who projected the original number, and then they came back and said that they thought the number was going to be much higher than it was. We've evaluated those numbers, and it does look like there's going to be an additional 100 students going into that school, Mr. Speaker. The same issue happened in Yarmouth, in my own constituency, where we had to have a delay because there was an increase in enrollment at a school that wasn't projected. The fact of the matter is, Mr. Speaker, these schools are going to serve our communities for generations. We want to make sure they're built to the proper size so they can do just that. Thank you very much.
The Honourable Member for Dartmouth East.
Mr. Speaker, government committed funding to this new school 8 years ago, yet hundreds of families are still waiting. Now students are crowded in a facility with overcapacity. There's no art room, no music room, and the Excel program is impacted. There also is not a proper gymnasium. There simply isn't enough space at this school. Does the minister believe it's fair for students to shoulder the burden of government's mismanagement. Thank you.
The Honourable Minister of Education.
Mr. Speaker, mismanagement would be doing what that member has asked us to do, to build a school that isn't at the proper specs. We're actually taking our management position very seriously, ensuring that the school we build, which is going to serve that community for at least 30 years, is built to the proper size, Mr. Speaker. I don't know how anyone in this House can argue the logic of that. Thank you very much.
The Honourable Member for Dartmouth North.
Mr. Speaker, my question through you is for the Minister of TIR. Time and time again, the Premier tries to argue that his government only makes decisions based on evidence. However, I think this argument is lost on all those communities in need of a new school who were no doubt frustrated to learn that new schools would be built in the ridings of the Premier and the Deputy Premier. This, Mr. Speaker, despite the fact that the evidence provided by the school evaluating committees suggested that these two new schools were not a high priority. So I ask the Minister, can he explain how the decision to build two new schools in the ridings of the Premier and Deputy Premier was evidence-based?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question. She's referring to my constituency, Mr. Speaker. I know she's a new member to the House. Fact of the matter is that the school that was approved for my riding was approved by the Democratic Party when they were in government, Mr. Speaker. Fact of the matter is, if she followed the process, it was on the list. If she goes back to the school in Tatamagouche, Mr. Speaker, was approved in 2008, Mr. Speaker. What she should be appreciative of, Mr. Speaker, is that we're actually acting and getting the job done.
The Honourable Member for Dartmouth North.
Mr. Speaker, there could very well be good reasons for those schools in those ridings, but the point is we don't know them because the process is not transparent. I think as the Minister responsible for infrastructure renewal, or the Premier, the members opposite should be taking the lead to ensure that the decisions about public infrastructure are open and transparent. Getting a new school should not depend on whether or not you live in the Premier's riding. So I ask the Minister, or the Premier, would he not agree that it is time to take the politics out of the school capital planning process? Thank you.
The Honourable Premier.
Speaker, I'm not sure, Mr. Speaker, whether she was suggesting by her party approving a school in my riding they were trying to buy my seat. Mr. Speaker, that actually didn't happen, didn't work. The fact of the matter is, Mr. Speaker, we continue to move forward, Mr. Speaker, to continue to invest in schools across this province. I'm very proud of the work we've done. She would know that the school boards have put those in a priority, and I would encourage her to pick up the phone and call the Annapolis Valley School Board. I would encourage her to pick up and call school boards across this province, both the boards on the list. The honourable member, it was on the list.
The Honourable Member for Sackville-Beaverbank.
Thank you very much, Mr. Speaker. I ask through you to the Minister of Justice. On Tuesday this week, Halifax Council voted to provide additional funding for the Navigator Street Outreach Program. As All Nova Scotia reported, the program costs $90,000 a year, and a recent report showed that last year it helped over 220 people. The program funds social workers who assist people by way of clothing, training, helping with damage deposits, bus tickets, utilities, etc. The Department of Justice used to provide a series of grants to help pay for this program, but have recently stopped. My question is, does the Minister see the merits of this program, and does he agree that the province has a responsibility to assist in its funding?
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I thank my colleague for the question. As he would know, being a former municipal councillor, the relationship between the municipal and provincial government is absolutely essential to find progress and advancements in program delivery and services to our communities. I applaud Halifax Regional Municipality for continuing the support of the program. We certainly support the program, but, Mr. Speaker, more importantly, we support the roles that our municipal governments are taking in providing lead responsibilities and ensuring that programs continue.
The Honourable Member for Sackville-Beaverbank.
Thank you very much, Mr. Speaker, and I thank the Minister for the comments. Of course, the number of people that are in dangerous and inadequate housing, along with those being forced on the street, continue to grow. Halifax now is one of the 10 most expensive cities in Canada to live, and the cost of a one-bedroom apartment has risen by more than 10% in the last year, and I would table an article that was in Metro. It's become harder and harder for people to find good jobs, and without a roof over their head, it's even harder. And all these factors contribute to making programs like this even greater. My question is, will the minister commit to restoring funding that once was provided by the Department of Justice towards this program?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. And again, I agree with the circumstances that my colleague has presented. This is a very worthwhile program. But what's not lost, Mr. Speaker, is the relationship between municipal and provincial governments and municipalities taking a lead role in continuing to provide services. They recognize the challenges that we all face. They have found room in their budget. I applaud them for that, and we'll continue to work with them wherever we can.
The Honourable Member for Kings North.
Mr. Speaker, my question is also for the Minister of Justice. Mr. Speaker, the 19-year-old who had Waterville Youth Detention staff terrified is now reportedly back at the Waterville facility. Earlier today, I tabled a petition expressing local citizens' concerns. Earlier this session, I asked the Minister about the Waterville Youth Detention Centre being prepared to have this person. At the time, the Minister reported being 84% complete on the recommendations stemming from the last event this offender triggered. Mr. Speaker, my question for the Minister is, since the offender is now back at Waterville, can the Minister inform this House if the remaining 16% of those recommendations were completed?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. What I can share with my colleague is that we continue to work on those recommendations. One of the ones that I am most familiar with is the CCTV system. Mr. Speaker, when we spoke last, that equipment had been unordered. We now know that that equipment is on site, and we're waiting for the service provider to do the installation.
The Honourable Member for Kings North.
Mr. Speaker, I'd like to thank the Minister for that answer. Mr. Speaker, under the Occupational Health and Safety Act, Section 82, which I'll table, a violence risk assessment is required in circumstances of significant change in the workplace, or if the interactions that occur in the course of performing work change. And I've just tabled that. I think, in the opinion of the citizens of the Valley, this offender's presence there would be very significant. My question for the Minister is, the Minister has an obligation under the Act to keep staff safe. Has a violence risk assessment been done for the reintroduction of this offender?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. Shortly after the incident, the Director of Corrections Services himself initiated a process to review the circumstances of that event, Mr. Speaker. It aligned with all of the occupational health and safety requirements. There were a number of recommendations, 42 categories, 103 recommendations come out of that. My understanding as of today, Mr. Speaker, 91 of those recommendations have been implemented. We continue to work, Mr. Speaker, in ensuring that the Waterville facility is safe for both young persons and employees who work there. There is a process, Mr. Speaker, internal responsibility systems that allow for that to happen. We encourage employees to engage managers so that those issues and concerns can be advanced through that system.
The Honourable Member for Sydney River, Myra, Lewisburg.
Thank you very much, Mr. Speaker. Mr. Speaker, my question through you is to the Minister of Health and Wellness. In June 2016, with great fanfare, Mr. Speaker, and just a few days before hundreds of people gathered to talk about the lack of doctors, this government announced an expanded collaborative care team for Cape Breton. It was a $400,000 announcement to recruit 2 doctors, a nurse practitioner, a family practice nurse, a dietitian, and 1 other member that would be named at a later date. Mr. Speaker, the question I have for the Minister of Health and Wellness: can the Minister of Health update the House on the number of positions that have been filled for this collaborative healthcare team?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. As the member would know, there's ongoing work recruiting throughout the province for primary care providers, Mr. Speaker. A big part of that initiative is providing opportunities and supports, Mr. Speaker, to attract and provide opportunities in collaborative practices, Mr. Speaker. That includes supporting individuals that provide the primary care services and supports, the opportunity and the ability to work together to provide those primary care services, which is a new way of practicing in the relative context of primary care services, Mr. Speaker. That also includes, in some cases, like in Cape Breton, providing investments for an actual facility and the work for site location for a facility in just outside the Sydney area, Mr. Speaker, is ongoing. Thank you.
The honourable member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker. And I think the member would know that there's 100,000 Nova Scotians that need a doctor today. Not a year ago, not 2 years ago, today, Mr. Speaker. On April the 17th, this very government said they had another announcement in Sydney that they would be getting 2 nurse practitioners and 2 family practice nurses. Now, Mr. Speaker, according to the Physicians Opportunity website, this week alone in Sydney, we need 4 family physicians, 4 psychiatrists, 3 pathologists, 1 respirologist, 1 pediatrician, 1 infectious disease specialist, an ophthalmologist, a radiologist, and a child and adolescent psychiatrist. Just in Sydney, Mr. Speaker. Will the minister tell the House if the Sydney Collaborative Care Facility is ever going to be staffed, and what is he doing to fill the rest of these positions?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I appreciate the member's question. It gives the opportunity, Mr. Speaker, to highlight the many good things being done with respect to recruitment across the primary care services, Mr. Speaker.
Order, please. The Honourable Minister of Health.
That includes investments that we've made in our budget to provide opportunities to expand the residency program, Mr. Speaker, to introduce a clerkship program. For third-year medical students, Mr. Speaker, that will encourage them to work. That's a program dedicated to Cape Breton in the early stages, Mr. Speaker. Our announcement just went out yesterday, Mr. Speaker, with the first time ever having the Nova Scotia Health Authority partnering with our Office of Immigration to attract international professionals, physicians, Mr. Speaker.
Order, please. The Honourable Minister of Health.
This work, Mr. Speaker, complements the commitment we made in our budget to provide an international medical graduate practice-ready program, Mr. Speaker, for assessment in Nova Scotia. These are all things moving forward, Mr. Speaker.
Order, please. The Honourable Member for Sydney River Myra Lewisburg will come to order. The Honourable Member for Halifax Needham.
Mr. Speaker, my question is for the Minister of Natural Resources. Today, outside this House, the Healthy Forest Coalition is holding a forest funeral rally. Woodlot owners, forestry workers, scientists, Mi'kmaq people, grandmothers, and more people are marching outside Province House to send a message to us all, to elected officials, that they want to see an end to irresponsible, wholesale clear-cutting of our forests. So I ask the Minister, will she admit that the people of this province have no confidence in the ability of this government to manage our forests?
The Honourable Minister of Natural Resources.
Thank you, Mr. Speaker, and thank the honourable member for the question. I certainly was aware of the event today and certainly respect the public's passion about our forests in Nova Scotia. It certainly makes me feel good to know that people are very passionate about our resource, as is our department. You know, we have biologists, forest management specialists in our department, and hundreds of men and women very qualified that make sure our forestry resource is looked after. Beyond that, the reality is, Mr. Speaker, that 80% of our land base in Nova Scotia is forested in one way or another. Only 1% of our resource is used every year, and actually we have more land forested in Nova Scotia now than we had 100 years ago, Mr. Speaker.
The Honourable Member for Halifax Needham.
Mr. Speaker, land that is forested in one way or another is not necessarily suitable for wildlife habitat, economic activity, ecological and environmental and social values, and that is what the people outside are saying. So my question again to the Minister is, one way to increase public confidence is to take the management of Crown land out of the hands of the department and place it within community. The Natural Resources Strategy called for the establishment of community forests on Crown land, and that has led to the development of the Medway Community Forest Co-op, which is trying to develop a long-term plan to manage the working forest and nurture forest-based businesses that support the local economy. My question to the Minister is, when will we see the next community forest in Nova Scotia?
The Honourable Minister of Natural Resources.
Thank you, Mr. Speaker, and thank the honourable member for the question. The Medway Forestry Co-op is certainly a great venture, and they've been doing really great work, but they're not the only ones. DNR, if you look at Crown land base in Nova Scotia, it's about a third of the land base of Nova Scotia is Crown land. Of that, almost 13% is either protected or nearing protection. That only leaves a small resource that is actually Crown land that is still forested and subject to the regulations surrounding that. We have an integrated forestry resource program, the forest management program, that outlines that decisions are made based on science and evidence. We will move forward with that same procedure to make sure that our resource is sustainable and remains sustainable. Thank you.
The Honourable Member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker. Mr. Speaker, my question to you is to the Minister of Health and Wellness. Mr. Speaker, we hear the Minister reply time and time again about what they're going to do in the future. Yet there are 100,000 plus Nova Scotians who do not have a doctor today. He keeps on saying that we have a plan. That government promised a doctor for every Nova Scotian. What the people of this province, the constituents of my constituency, want to know is, when are they going to be able to have a doctor? Not 6 months down the road, not a year down the road, Mr. Speaker. They need a doctor today.
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member would know, my comments aren't talking about what's being done in a year from now, Mr. Speaker, 6 months from now. Mr. Speaker, what I was explaining in our previous responses, Mr. Speaker, in a previous discussion, was actually what we are doing today, Mr. Speaker, what we are doing right now actively with the Nova Scotia Health Authority. I mentioned, Mr. Speaker, what we did in our budget, Mr. Speaker, which that member and his party voted against, Mr. Speaker. He voted against new residency seats in Cape Breton, in the Sydney area, dedicated to bring physicians to his community, Mr. Speaker, and that member and his party voted against it. And that's happened here now.
The Honourable Member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker. And yes, what I voted against was a bunch of hollow promises that was put forward by a government that doesn't care for the people of province of Nova Scotia, that don't care about how to get health care. I voted against an incompetent government that does not do what they said they were going to do, Mr. Speaker. Mr. Speaker, that member, that government promised over a year ago for collaborative care practice in Sydney. This year, they promised for nurse practitioners and family practice nurses. They promised a doctor for Nova Scotian, every Nova Scotian, and it's not happening, Mr. Speaker. So the question is, when will the people who need a doctor today be able to finally get the service that they richly deserve by this health government?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for both his question and his passion on the floor. Mr. Speaker, I think the member opposite just indicated that he voted against. I believe the comment was incompetence, Mr. Speaker. Well, I think the majority of the people in Nova Scotia disagree with that member's opinion, putting this government back into power, Mr. Speaker, for a second term in office. The first time, Mr. Speaker, in decades that we got back-to-back majorities, Mster Speaker.
Order, please. Order, please. The Honourable Minister of Health has the floor.
Mr. Speaker, if the members on this side of the aisle, Mr. Speaker, are incompetent, then that member wonder what he thinks of the people of Nova Scotia who put us back here again. Thank you.
The Honourable Member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker. I hear what the minister has to say, and he's bragging about the majority they have. And you know what, Mr. Speaker? they haven't used it to help the people of the province. They, in their election campaign, made promises about the health care system in this province. This same government has not delivered on those promises. You tell me, when you have a lady that can't get a mammogram, when you have a doctor's office that can't take any more patients, we're supposed to say they're doing a good job? I would like that minister to tell the people of the province of Nova Scotia just exactly what we're supposed to do when we need the services of medical professions in this province.
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. Again, Mr. Speaker, as the member would know, there's fantastic services being provided by the men and women on the front lines of our healthcare system, Mr. Speaker. The doctors, the nurse practitioners, the family practice nurses, Mr. Speaker, the RNs, the LPNs, these people are providing fantastic services to Nova Scotians from one end.
Order, please. Order, please. The Honourable Minister of Health.
So these, Mr. Speaker, these frontline healthcare professionals are providing fantastic services to Nova Scotians from one end of the province to the other.
Order,
right now,
please. I will not tolerate any more disrespect for the chair. The Honourable Minister of Health has the floor.
Thank you, Mr. Speaker. They're providing great services, Mr. Speaker, from one end of the province to the other, Mr. Speaker. The commitments that we make, Mr. Speaker, we continue to work with Nova Scotians. We've invested in over 2,000 additional orthopedic surgeries, Mr. Speaker, since coming into office, and we've just committed more money to provide additional services, Mr. Speaker. We're moving forward with investments in our mental health services, Mr. Speaker, to improve those services for Nova Scotians. We continue to deliver on behalf of all Nova Scotians. Thank you.
The Honourable Member for Sydney River, Myra Lewisburg.
Well, thank you very much, Mr. Speaker, and I just want you to know that that health minister couldn't deliver a pizza, let alone good health care.
Order, please.
Mr. Speaker.
Order, please. Order, please. I'd like to ask the Honourable Member just to retract that comment. I found that disrespectful. The Honourable Member for Sydney River, Myra Lewisburg.
For you, Mr. Speaker, I'll certainly do that. But, Mr. Speaker, I am a product of the healthcare system, and there's nobody knows any more about how professional the healthcare professionals are in this province than I do. But also, Mr. Speaker, I also know that there are hundreds of doctors across this province and nurses across this province that are speaking out about the need for extra help because they cannot continue on in the pressures that have been put on them by this government. So, Mr. Speaker, instead of singing his platitudes another time, would he please tell the doctors, the healthcare professionals, and the people of the Nova Scotia when he's actually going to do something real instead of making hollow announcements?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and again, I appreciate the member's question. Again, the work that I've been doing, Mr. Speaker, since having the privilege to take my position as the Minister of Health and Wellness for the province of Nova Scotia. Mr. Speaker, I've reached out with two frontline health care workers, Mr. Speaker, to hear directly from them, Mr. Speaker. Rather, Mr. Speaker, reaching out to hear from the frontline health care professionals, Mr. Speaker, see what their concerns are, Mr. Speaker, because I have to tell you, Mr. Speaker, that not in all cases, Mr. Speaker, are those concerns that I'm hearing from frontline professionals the same as what the opposition, Mr. Speaker, are bringing to the floor of this legislature. I continue to listen. We continue to work together to move forward our healthcare system on behalf of all Nova Scotians, Mr. Speaker, and that's the commitment I make to Nova Scotians and the frontline healthcare workers to continue to do so. Thank you.
The Honourable House Leader for the Official Opposition.
Mr. Speaker, the Westmount Manor in Bridgewater is a public housing unit that is designed for seniors. They've been promising a lot of things by this government. At the present time, they're living with dirty floors, moldy floors, broken tiles, cobwebs, broken doors, and latches, and I think it's probably pretty much the same as many seniors housing units across the province. So my question to the Minister of Community Services, has the Minister allocated any funding this year to fulfill their promises to these residents of these facilities?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question. In fact, Mr. Speaker, we are investing quite a bit of money in our seniors facilities, making sure that the physical side of those buildings are in fact taken care of. We've gone and done an assessment of the buildings, and we're working through the list to make sure that those are brought up to speed. Thank you.
The Honourable House Leader for the official opposition.
Mr. Speaker, these are seniors that have worked and contributed their whole lives and find themselves living in a facility that gets a lot of promises from government, but not many deliveries. Senior living as a government-operated facility deserve better than this, as do all seniors. The government has been promising an updated continuing care strategy since 2013. And I mean, this strategy is really late, and I know it fits in to the mandate of the Minister of Community Services and Housing as well. So will the Minister tell members of this House and those living at Westmount Manor and many of these other manors across the province if their facility is part of the plan for the new continuing care strategy, and when will they see their promised upgrades?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question, and I do want to be very clear with him if there are any concerns that he has or that any member has about public housing or seniors housing in their particular area. I would ask that they please bring them to my attention. I have directed our Housing Nova Scotia staff and the folks in the authorities to make sure
Order,
that
please.
they are
Time allotted for oral questions put by members to ministers has expired.